Who here knows somebody with cancer? If you'd like to raise your hand. Oh, wow. Pretty good amount of you. Okay, does anyone here, it's unlikely, but has anyone here had to suffer through cancer themselves at any point? Okay, I didn't expect to see any hands up. Is there anybody here who wants cancer? Huh? Okay. I recently attended the funeral of my wife's Aunt Mary. She, throughout her life, has had issues with cancer. She fought and she beat breast cancer, but ultimately, her life was ended by kidney cancer. On September 27th, my family participated in a run for cancer awareness. There I learned that 5 other of my wife's family have been subjected to cancer. They also perished because of it. These are all forms of hereditary cancer that they died from. It was colon cancer, breast cancer, like I mentioned, or rectal cancer. And some of them fought multiple forms of cancer throughout their life. Today I'll explain hereditary cancer, how it develops, current theories for treating it, and options for preventing it as well. First, I'll briefly explain what hereditary cancer is and why those who are affected by it have a greater risk of developing cancer than those who may be affected by what's called sporadic cancer, or a cancer that develops independently of genes inherited from your parents. As the name suggests, hereditary cancer is, as stated by the Memorial Sloan Kettering Cancer Center website, the development of cancer due to an inherited gene mutation that has been passed from parent to child upon conception. Actually, light. So here we have an image of what you might consider a healthy cell. Can you guys see that okay? With a healthy nucleus, the chromosomes, the DNA, that's where we receive our genes from our loving parents. This next image I have kind of gives you a comparison between a normal group of cells and then cells that are afflicted with cancer. As you can see the differences in their look, the normal cells look more symmetrical, they're cleaner, whereas the cancer cells, they have multiple nuclei, whereas the normal cells have a single nucleus, which is one of the reasons why the cancers grow kind of out of control. They just do whatever they want, they're not regulated, and that's part of the problem. Looks like they turn into tumors. Light back on. Like we said before, though, as I mentioned, the genes inherited from parents, they give you a greater risk of developing cancer. That doesn't necessarily mean it's guaranteed. A lot of people can inherit these risks but not have it develop into anything further. And according to genetics.com, genetichealth.com, it usually takes more than one mutation on a cell to cause cancer. So a person who does inherit these genes, they'll become that much closer to developing some form of cancer. Okay, so now we talked about what hereditary cancer is. We're going to talk about some of the current methods to try to prevent this cancer. One of the methods is just having a routine checkup. If you know that you're susceptible to cancer because of family history or whatever, it's a good idea to go in to the doctor on a frequent basis. My wife, for example, she's had a tumor in her wrist. She's going to see the doctor on a 6-month occasion. If nothing happens from that, a year, 2 years, then eventually not so much. Another way to find out if you have cancer or to prevent it is to go in for cancer screening. According to the Memorial Sloan Kettering Center Cancer website, cancer screening tests are recommended to detect the cancer in its earliest and most curable stages. According to cancer.gov, clinical testing is designed to identify the presence of a specific cancer in a symptomatic individual or population thought to be at risk of that specific cancer. Finally, we'll talk about some of the methods for treating cancer. The first one I like to bring up, I'm sure everyone's heard about, is chemotherapy. The way chemotherapy works, it's administered via injection as depicted in this picture here. This young woman, she's receiving, it's kind of hard to tell because of the picture, but an injection of the drugs. It can also be administered orally through pills. Some of the side effects include, as you can see here, she's lost her hair. The treatment doesn't only kill cancer cells, it also controls or kills other cells, fast-growing cells like hair or blood cells. According to chemotherapy.com, other side effects include nausea, vomiting, and fatigue. there is also radiation therapy, which is a little nicer than chemotherapy because the side effects aren't as widespread. They're more locally located on a body. As you can see here, the radiation rays, whether they be gamma rays or some other form of rays, they can be specifically pointed in one direction, so the side effects aren't as widespread. The side effects for radiation therapy also include blistering, burned skin, hair loss, and depending on the location of the therapy, there could be problems with the digestive system. Another form of treatment is immunotherapy, which is interesting because it uses a person's own immune system to fight the cancer. This can be done through either stimulating the immune system to work harder and smarter, or injecting or somehow putting in man-made immune proteins, which is really great. So I hope that the result of this presentation, as a result of this presentation, we've all had a greater understanding of hereditary cancer, what it is and how it can be prevented, and some of the current methods for treating it. I mean, perhaps you will know someone who has cancer. For those of you who raise your hands, you obviously know somebody. My wife, I knew that there was a history of cancer in her family. However, I didn't know how far-reaching it was until just recently. 5 members of her family had died because of it. I wasn't aware, and now I know that she's at a greater risk, and so I'm kind of keeping my eyes out on her behalf. She doesn't like going to the doctor, so it's kind of a struggle there to get her in, to get her checked out for stuff. The nice thing is, as science continues to develop, especially medical science, and our technology and understanding of cancer, we are becoming ever more capable of fighting it. It's a negative result of being mortal, but life is full of challenges, and this just happens to be one of the ones that some of us are closely connected with. And hopefully, like I said, we can find more effective treatments in the future. Thank you.
So, John, what did you think? John, you're not there? No? Life happens. I'll tell you what I thought. I didn't think that the audience survey worked nearly as well as talking about the funeral that you recently went to, and I thought that that would have worked more effectively as an attention device, and then maybe use the survey as a transition instead of as the attention device. The topic is very clearly identified. I think the thesis needs to be sharper, but you have an excellent preview of where you're going to go with the subject. I did think that the third point seemed a little bit less relevant to the issue of hereditary cancer, because it's more about the general issue of cancer when you're talking about the different treatment techniques. Although I did find some of it interesting, and I would have liked to have a little bit more information about the immunotherapy. I think that people are kind of familiar with the other two, and you gave them enough attention, but it's that other one that I think could have used a little bit more development. I thought you had some good citation of materials in the first couple of points. Again, something else that I thought of, you talked about cancer screening, and I was wondering how cancer screening works. Does it work differently for people with genetic risks of cancer? You know, and I think you kind of touched on that issue, but there were some other questions I think needed to be developed a little bit. You did a good job bringing in some personal interest and using your own experience and helping make this something that's more relevant. It's very well organized, and the signposts are very clear. The visuals are fine. You showed them at appropriate times. You've seemed to have an awareness of the fact that you needed the light off to see some of the images, but you didn't need it off for the whole time that you were speaking. The comparison between the healthy cell and the cancer cell explained the issue reasonably well. On the presentation, I think you do a good job for the most part. Sometimes your pacing is a little bit off, and I do think you tend to drop your voice in a couple of places, but it wasn't a big deal. It's just something to be paying attention to. You had a good summary, but it seemed like you had a long exit, and although I thought it was a pretty good exit, it seemed like it came far after the summary of the speech, and so maybe it could be edited down a little bit. All right, thank you.